Alrighty, Mastopexy reduction, day 1 to week 1. When you've had a mastopexy, we're going to send you home in a bra, or a reduction, we're sending you home in a bra and a wrap around your breasts. That wrap around your breasts is important to hold things in a nice, high, tight position. We want things to heal as tight and as high as we can keep them. We will have stitched things in place to your chest wall. Your breast gland will be restitched to your chest wall. So those stitches are holding things up at first, but those stitches aren't strong enough by themselves. So that wrap and that bra are super important to keep on. That first night otherwise should be pretty simple. You shouldn't have drains. It's very uncommon for us to place drains in those procedures. You should be able to be up, moving around, walking around, and I advise that you do, but you shouldn't be doing work around the house. Even though you might feel well, and most patients after a mastopexy or breast reduction really only take pain medicine for a day or so, and look at your different medications and make sure you take them as prescribed. The pain medicine and the anti-nausea medicine are to be taken on an as-needed basis. The antibiotics to be taken for the next 3 days as it's prescribed on your bottle. But for the most part, you'll probably feel pretty well. Most patients can go back to driving a car within a couple of days, can be back to work in less than a week. We do ask that you don't, when you're taking a shower, which you can do right away after surgery, whenever you feel up to it, but we ask that you don't take a bath or get into a pool or jacuzzi. We ask that you protect those incisions from submerging in water, because that can increase our risk for infection. If you notice anything like excessive swelling in one breast versus the other, or excessive pain in one breast versus the other, this is something that we need a phone call about, and that should alert you to call us to check, because what we're going to want to know and we're going to want to see you for is there any bleeding on that side. Breasts can bleed. They're very vascular structures in part of them down around our pectoralis muscle and our chest muscles, and so that can occur. It's an uncommon complication, but pain and swelling in one side and not in the other is definitely a sign of that. Additionally, with your pain medicine, make sure you're taking a stool softener, and if you feel constipated, take a laxative early on so you don't get constipated, as sometimes that's the most discomfort you'll have. Otherwise, you should be back to normal pretty quickly, and we'll see you for your post-op visit just after a few days.